I'm Steve Vieira, Assistant City Manager. I'd like to thank you all for being here with us this morning. It's a truly exciting time for us all. This is our opportunity to meet our new Public Health Director, Dr. Fawzia Khan. And with that said, I'd like to introduce our first speaker, our Mayor, Paulette Guajardo.
Maybe over, yeah, maybe that way. Okay, good morning, everyone. How are you? Well, thank you all for being here. Good morning, Peter. And the team back here, this is awesome. You guys are amazing. Well, first, before we get started, I'd like to recognize some people in the audience. Councilman Mike Pusley, at-large Councilman Mike Pusley. Councilman Roland Barrera, District 3. We have County Commissioner Joe Gonzalez, Precinct 2. County Commissioner Robert Hernandez, Precinct 1. Wow. Chief Markle in the back right. Chief Rocha, center left, back center. Mr. Billy Delgado, there you are, Billy. And with TAMU CC, we have Dr. Loika. Where's Dr. Loika? Raise your hand. Where's there you are. I'm sorry. Yes, and Dr. Aziz. Thank you for being here. With MHID, we have Dr. Falcon. I'm sorry. Dr. Falon, there you are. And Dr. Brewer. Thank you, Dr. Brewer. And our mental health director for Nueces County is Xavier Gonzalez. Thank you for being here. And with the Coastal Bend Wellness Foundation, we have Bill Helcher, and Meredith Grantham. Meredith, thank you all for being here. So as I like to say, and will continue to say, it is a new day in Corpus Christi. And this actually may have really been the reason I started saying that when we started working on this endeavor of making our health department what it should be, our health district, I should say, what it should be. And today I stand before you as the mayor of Corpus Christi and very proud of the people behind me because they are who really made this happen. Leadership matters, but they are who made this happen. And today we truly celebrate one of the biggest new days of the city of Corpus Christi. It's been 40 years, ladies and gentlemen, 40 years. It is an honor to stand here to say I was a part of this. You were a part of this. Everyone standing behind me and some were a part of this. And what is this? This is progress. This is Corpus Christi being the 8th largest city in Texas and owning it through our health department, our health district. This is being able to tell the story, which I've already been asked to do, because people know. They know what's happening here, what's happened in Corpus Christi, and they want to know, how did you do it? What did that take? Because they know what it was, and they know that we made a huge change, and it is for the better. Our health district serves an underserved community that we care about. That's what this is about. It is not political, and it is not anything else. It is about serving people in the best way possible. That is our job. And the people who come here for services, they're equal to all of us. And we actually owe them. We owe them programs. We owe them education. We owe them the right vaccinations to be offered. We owe them endless services because that's what we do. And today we are celebrating being able to do that in the best possible way and to our fullest capacity, which was not so before. So I'm very excited to be here. I'm very proud, and I'm just proud of the team because that's what this is about. We're so happy. We want better health outcomes in Corpus Christi, and that's what we're doing with our new health district. We want the best use of your tax dollars. That's what we're doing today. And of course, we are only as good as our team. And our team has to have the best work environment that we can afford. And that is also what we're doing today. So thank you. With that, I'm going to hand it over to our city manager, Peter Zanoni, to say a few words, and then we'll hear from Dr. Khan.
Great, thank you, Mayor. That was really exceptional. Yeah, great comments to start our process. And today, as the Mayor said, marks a very important step in developing a new business model for our public health district. So the Mayor did a little bit of this, but let's remind ourselves about a year ago, it was about a year ago this month in October of 2021 that we began the policy conversation with Mayor Guajardo and City Council members, many of whom are sitting with us today, to create a new public health district for not only Nueces County, Corpus Christi, but the region. We know that for 4 decades, folks, 4 decades, both the City of Corpus Christi and Nueces County tried to manage the health district as 2 separate entities. There were 2 board of directors, the council and the Nueces commissioners. There were 2 sets of employees with different pay ranges, different holidays, different times off. There were 2 fiscal agents. There were 2 budgets every year. But there was no one way to reach consensus and to lead the health district, to help our community. Now, there have been attempts over the decades, there's many attempts that managers, city managers, councils, and commissioners have tried to do to reverse this, but they've all failed until this one city council and one mayor and commissioners court decided to do something about it. And that brings in a new era of public health for our community. The mayor mentioned this, and we all know it, but our overarching goals in reaching this journey were 3. We want better public health outcomes for our community, better public health outcomes for our community and region. We're tired of wasting taxpayer money when it comes to public health, and we want to create a better work environment for our health district employees. A focus on our talented and dedicated health professional teams was one of those goals, right? That was that 3rd one. And the reason that goal is so important to us, the mayor, to me, to the entire organization, is right behind me. This is the reason that item number 3, a better work environment, was crucial for us. Today, we want to thank every employee standing behind me for helping us reach this milestone in our public health. And also, let's not forget, in pulling us through COVID-19, that terrible pandemic that was so disruptive to the nation, to the world, and even to us locally. I made a promise to these employees behind me that I would be with them every step of the way. That was one of the first things we did when we talked to the mayor and council about let's try to move in a different direction. We met every Friday for months, and when we couldn't meet because of COVID outbreaks, we sent video messaging to the team behind me. Now, close to Thanksgiving, about a year ago, the team did say, Peter, you know what, we like meeting with you, but we got to get our turkeys, and we got to get ourselves organized for Thanksgiving, so skip that one Friday if you can, right, because we want to get ready for our families. So we did that. We let them have that time off. But just 2 Fridays ago, we came back again to see how things were doing, to see what the progress was, and to let them know about Dr. Khan's coming here. And I told the employees a year ago that they, as the mayor said, would be the most instrumental in creating a new business model. It wasn't going to be me, it wasn't Steve, it wasn't a consultant that we never hired anyway. It was them, the employees right behind me. And so they're leading us in this new direction. We want to thank them for that. Let's give them a round of applause, please. Now, again, we owe a lot to the mayor, the city council, and Nueces County commissioners, and we're glad several of them are here with us today as we move forward with a new business model for better public health outcomes in our community. But a final piece in that program is our director of public health, Dr. Khan. It took us some time to hire the new director, 7 months to be exact, but we wanted to make sure we had the right person. And as an organization and as a community, we are so fortunate, Dr. Khan, that you accepted our offer to work here. Dr. Khan has practiced medicine. She has studied and focused on the business of public health, which is different than practicing medicine. She has worked with specific populations across the globe. She is a leader, and she is an advocate for all employees, and that's an important note for my team behind me. Dr. Khan is going to be our best advocate for our over 100 employees in public health. She knows how to run a large organization. She knows how to hire, and more importantly, to retain staff. She knows how to build relationships and how to build consensus, and we thank our public partners that are with us today. That speaks a lot. Dr. Khan will be working closely with you to change what has not always been our practice, to reach relationships and build consensus. And maybe most importantly, Dr. Khan is very excited about taking this job. She is, right? She's going to tell you in a moment, but she is. Now, for me, I knew Dr. Khan was the top choice when, in our interview, she said, you know, Peter, when I come to see Corpus Christi, don't even bother taking me to those areas where tourists usually go, our beautiful Ocean Drive. Don't bother taking me down to the beach. I don't really care about Padre Island so much. What she said is, Peter, instead, please take me to the most disadvantaged and underprivileged areas in our community, because that's where we'll find our first priority clients that we want to engage to create better health outcomes for them. That sold it for me, Dr. Khan. I think it will for the community as well. So today, we have our city employees, we have our elected officials, and we have our partners all here to welcome you, Dr. Khan. I encourage them all to make you feel welcome, to make you feel at home, to familiarize yourself and to love this community as we do. We truly are fortunate that you've chosen Corpus Christi, Texas, to be here to lead us in our public health efforts. And with that, please come up to the podium now and tell us a little bit about yourself and your vision for the health district.
Good morning, everyone. It's hard to follow after the respected mayor and city manager, but thank you all. Council members, Madam Mayor, city manager, commissioners, other dignitaries, community partners, and media. I thank you all for being here. Appreciate your time, the warm welcome. Thank you, Mr. Zanoni, for the introduction. As Director of Immunization, I started in 2019 with a $4.8 million budget and around 20 employees. 3 years' time, $100 million award to immunization service, and 70 plus employees. It was a successful journey, and I'm happy to bring that learning experience to lead the public health district here in Corpus Christi. You're all aware, COVID has brought public health to the front lines. It is more critical than ever that we invest in our public health infrastructure, partnerships, and our workforce. One of the main reasons for me to take this job was that the goals of the public health district, better health outcomes, efficient use of taxpayers' dollars, and building a strong workforce were very in line with my own public health practice. Health district is an important component of the larger public health system, and equally important are community partners. I was fortunate to meet several last time during my visit, and I was impressed by the passion and the drive that they had for our residents. Universities, nonprofits, hospitals, private providers, food banks, shelters, media, the list goes on and on. Let's strengthen the partnerships that you already have with the health district, and let's build new ones. We want to work with all of you. Does not matter how large an organization you have or how small a budget you have. if you are providing services for the residents or you want to provide services, let's talk, let's explore opportunities as how we can have better health outcomes. What Peter mentioned, health equity is very close to my heart. During my last visit, police chief was very kind to drive us around to some impoverished neighborhoods. We want to work with the community partners to listen what the community needs from us. What are the health priorities as per the residents? Let's put public back into public health. Let's see how we can remove barriers to health care. Again, community partners and health districts, how do we increase coverage for public health services? Public funding would always be limited and there would be competing priorities. We have to have efficient ways of working together. Minimal overlap, efficient way of doing business. Let's talk more. The media, you can be such a huge partner and supporter for infodemic management. As you listen to the community concerns, bring those questions to us. Build resilience to misinformation. The second very important reason for me to take this position was this health department team. If I can hear an applause for all of them, and maybe after the first line, we could see the second. If the first line could move, so we could see the second and the third line. Thank you all. When I talk to them, it's a very professional and a diverse team, ready to provide the best to the community. I've been following their work, and I'm impressed by the achievements that they have made under Mr. Steve Vieira and Dr. Gonzalez's leadership. Dr. Dante, the assistant director, he received gold recognition for providing community services under the Texas Healthy Community Programs for 4 years. He also played a major role in applying and the city receiving $24 million COVID response grant. As you may be aware, the health department is organized into 3 pillars: prevention, promotion, and protection. Our public health administrator for prevention division, Ms. Deborah Houlihan. Ms. Deborah. Over 40 years of nursing service experience supporting clinical aspects of immunizations, tuberculosis, women's health, chronic disease. She was instrumental in vaccinating our high-risk population to prevent the spread of monkeypox. Thank you, Ms. Houlihan. Kevin Hensley, promotion division, 11 years of public health experience in HIV and policy. He is our yellow belt Six Sigma graduate, and he will work with us to analyze data so we can strengthen and support and mobilize communities and partnerships to improve health. We need data. We need to have baselines, where we are starting, where we are going. We are going up, we are going down, what are the factors? So thank you, Kevin. Denzel Otokunrin. Oh, but I do want to mention him, our epidemiologist. He sees the protection division as the experts town hall and helping the COVID-19 risk dashboard. As I get to know my team better, find ways to efficiently provide public health services, we'll be exploring grant opportunities so that we can bring more programs, more services, more training opportunities, not only for the public health workforce, for the health department, but also for the community partners. I'm excited to work with this great team, with the support provided by the city manager, the mayor, the assistant city manager. Thank you all to the existing community partners and the new ones. I'm here to learn and I'm here to listen. Let's communicate and work together to make Nueces County, the Coastal Bend region, and Corpus Christi a healthy community. Thank you all.
Thank you, Dr. Khan, and welcome to the team. Like I said, an exciting day for us here today and moving forward, and also because the Astros are going to the World Series, so I can't fail to mention that. That concludes today's event. However, we are asking that everyone stick around and please take a picture with us so that we can commemorate today's event. I believe we're going to have some type of still photo or aerial photo taken of the group here, so please join us up here up front so we can do that and get an opportunity to meet Dr. Khan. Thank you.
One last comment. So one last quick comment. Because in the midst of all of this, it was, Steve, don't go too far, come on. In the midst of all of this, it was Steve Vieira who was assigned, who had to leave his office at City Hall, which is not a big deal, but it is. If he left his office at City Hall, I remember saying, gosh, I don't see you anymore, ever, because he was here. He was a pillar. He was making sure that things were on track in the direction that we were all heading. So I want to thank you, Steve, for your leadership here. I want to thank you for all you have done. Thank you. Okay, so now that concludes the conference. So should we come up and do a picture? Yes. Are they going to move this? Okay.